I'm Stephanie Terrell, owner of Simply Women's Health. Here today we are talking about procedures we're doing here in the office. So I'd like to go ahead and introduce you to Kelly Sedensky.
Hi, I'm Dr. Kelly Sedensky. I'm the gynecologist here at Simply Women's Health in Meridian, Idaho. I'm the physician who performs the Essure tubal ligation.
What does a Essure tubal ligation consist of?
So the Essure tubal ligation is another form of tubal ligation, which is essentially an irreversible type of permanent sterilization.
And how do you do that here in the office?
It's a minor procedure that we perform here in the office. Patients are asleep for the procedure. Essentially, a small camera called a hysteroscope goes through the cervix and into the uterus. Through that camera, we're able to thread coils or inserts up into each of the fallopian tubes.
And this entails scarring the fallopian tube. So how do you check to make sure the fallopian tubes are scarred?
So over a 3-month time period, the coils typically cause scarring in the fallopian tubes, which allows them to close. At that 3-month mark, patients will need to have an imaging procedure called the hysterosalpingogram. Essentially, dye is placed into the uterus to make sure that the fallopian tubes are closed on both sides.
So how effective is that usually after the 3-month time frame?
So if the tubes are found to be closed, which they typically are, the procedure itself is over 99% effective, similar to the other forms of permanent sterilization. I like to tell patients that nothing is 100% effective in preventing pregnancy except either not having sex or not having reproductive organs.
And is there any patient that this is not ideal for?
If a patient is still thinking of having more children, they should not consider permanent sterilization.
And are they out of their daily activity more than a day or two?
So with the Essure tubal ligation, most patients only need to take 1 to 2 days off from work the day of the procedure because they have anesthesia. They won't be able to drive. They need another adult around with them. And some women take the next day off of work in case they don't feel well, but most women return to work and activities the following day.
Any additional thoughts or questions that patients ask you in regards to Essure?
Some of the advantages of the Essure tubal ligation is that patients tend to have less pain than your standard or classical tubal ligation, which is performed in a hospital. That they typically have more pain and a little more downtime. Also, because we are able to perform the Essure tubal ligation in the office, it decreases the cost significantly for patients.
And is this a form of contraception that is covered by the Affordable Care Act?
Yes, the Essure tubal ligation is covered by the Affordable Care Act.
Great. So if a patient was interested in learning more about Essure or other contraceptions, what would you want them to do initially?
So if a patient's considering having an Essure tubal ligation, the first step is to call us here at Simply Women's Health and set up a consult to see if it's right for them.